Thank you so much for tuning in to this session. And what a great presentations that we have from the 4 panelists here. So Martin and Pete, persons living with HIV on the line. And then we have the perspectives from regional organizations, Eddy from Youth Lead, and from Raine, the Asia Pacific Transgender Network. Thank you so much for all the questions that's coming in. So what we're trying to do within the next 15 minutes is getting so many questions to these wonderful panelists. And I'll kickstart with a question to Martin. We have a question about, should a person with undetectable HIV status continue taking PrEP? If so, does this behavior again condone a behavior that's not acceptable in the normal society?
I think we just need to clarify if this is PrEP or it's antiretrovirals. But if you are HIV positive, then you shouldn't be taking PrEP. You should be on treatment because PrEP is not the full combination therapy. And so if you are HIV positive, then you should be on antiretroviral therapy. And because you're on therapy and you've managed to suppress the virus, then you should stay on therapy. Don't go off therapy, because it's only when you're on therapy and you've suppressed the virus are you undetectable, which is untransmittable. Does that help?
Yeah. So basically, keep taking your medication.
God, yes. And you know, it's quite hard in Asia, especially for some people, to take the medication openly. And that's something that we have a lot to do. I think people who are in NGOs on the platform should know this. It's important that you find a way to take your medication every day. If you can't take it at the same time every day, speak to your doctor to see whether that particular medication that you're taking, how much leeway you have to, how much time you have to take it. It's different for different medication. And there is antiretrovirals where you just have to take it every day. It doesn't have to be exactly the same time. So it just gives you that much more, less pressure.
Thank you, Martin. So now I'll move on to Eddy. There's some questions for you for young people. Currently, the I Give You campaign is really impactful in raising awareness amongst community about stigma and Uecosu. Will such initiative be able to launch in our region where stigma on HIV is still very high? And they want to kind of get your feedbacks on your thoughts.
Yes. Well, any campaign can work in this region. That's the first thing. You have to ask yourself, how far is the campaign willing to go? Yes, there are taboos in every country in this region, and some are different from others. If you compare countries like Vietnam to India, you're going to be talking about different issues. I mean, I do like to bring up Vietnam here. It's a really good case study in how they really mobilize the community with agency, the private sector too, to release campaigns that really address stigma and discrimination. So I think the important question here is, how far are you willing to take the campaign? But I think we should be able to launch campaigns such as the I Can Give You, I Can't Give You campaigns in this region, most definitely.
Oh, thank you. And now moving on to Pete. Could you please kindly speak about the influence of Uecosu campaigns on engagement with high-risk behaviors amongst young people living with HIV?
Okay. For some people living with HIV and people living in high risk, so like a people who have multiple partners, who have a condomless sex, who inject drugs. Okay, I as your friends, okay, if I understand all of you lifestyle or behavior, so please to I respect whatever you use your lifestyle, whatever you prefer to do. Please take care of yourself about HIV first. If you are a negative person, please take PrEP for make sure that your HIV status will become to be positive. And when you are positive, you go on treatment and get treatment, take a medicine every single day, and go make your HIV status to positive undetectable. So whatever you after that you can do up to you. Okay, what if you people who use drug, you can be safe yourself from your lifestyle. Okay.
So Pete, can I just follow up with another question? Is that you have been very brave to come out and talk openly about living with HIV, and also to start to advocate about Uecosu, in Thailand, where it's supposed to be not so stigmatized, and yet you mentioned in your presentation about the backlash that you received. How do you think, learning from that experience, how would you tell others in terms of doing some campaigns on Uecosu, learning from what you've gone through? My intention for advocate about Uecosu work or the knowledge about prevention tools or about the knowledge is about to reduce the stigmatized to people living with HIV in terms of external or internal, both of everything. I use the communication with the words to change the perception, the people, like people who affected by HIV and people living with HIV, it feels different when I talk to words. So when I speak something in word in English, and I have to translate to in Thai to feel more uncomfortable the words we have used to say in the past. So I have to explore what is the word the people living with HIV prefer to listen, and they listen to feel comfortable more. So I have a lot. I meet a lot with people living with HIV in Thailand. That I observe them. I try to communicate to them. That found out that I try to communicate and influence mixed method. Every single thing through my life, through my experience, through my daily life, through my expectation. Yeah. I think it came through very strongly from all the presenters about really involved in the community, coming up with those messages, because it can have very, the context is very specific, and it could be different in many of those settings. Raine, we haven't forgotten you, don't worry. There's a question for you about the Philippines, actually. For many HIV campaigns in the Philippines, the ambassadors, influencers, usually being used are beauty queens. Do you think it's appropriate and effective to reach and engage the transgender women community through this method?
Hello, everyone. So I think it's a very appropriate question coming from the Philippines myself. And to be honest, I think the beauty pageant is a very common thing, especially it's very popular in the Philippines, not only with trans community, with the larger LGBT community, even with cisgender communities as well. And I think it's always an option to always take ambassadors that are considered to be allies. They may be cisgender beauty queens, and they actually hold the ability to make messages and influence people. But I would also recommend having trans people who are living with HIV to be out, to be open, to actually become ambassadors themselves. It's the same way as how you approach prevention messages, or even improving or promoting PrEP, by actually promoting PrEP by having trans people, social media influencers, promoting the use of PrEP as an example, for example, here in Thailand. And the same approach we can apply if it's about Uecosu messaging, taking ART, PrEP, or PEP. So I think that's it.
Great. And I have a follow-up question on, yes, you mentioned about PrEP for transgender women being rolled out in Thailand. And I think this is something very positive, and hopefully other countries will also do the same. Will that have an effect in terms of the messaging on Uecosu? What's your perspective?
I think, as mentioned in the consultations that we had with trans community in almost 15 countries in Asia and the Pacific with our country partners, it's very, very new concept to them, or it's not very fully explored in terms of the awareness level on Uecosu. But I think the approach right now is that since it has not been fully explored, it goes back to the idea of using it as a prevention message, that it becomes part of your prevention message, even when you are not yet a person living with HIV. The same way that we use PrEP, promote PEP, at the same time. So I think for the trans community, if there is not a visible community of trans living with HIV, we assume and we presume to use it as a prevention message, as part of treat as prevention package as well. And we begin with that.
Okay, great. Wow, we have so many questions. So I hope our panelists are okay to have a rapid fire. Another one for Eddy. It is important to have a clear messaging on Uecosu towards young people on one hand. How about the case managers or medical providers attending to young people? How do young people recommend developing messages for case managers?
Okay, so the first things first is it's about identifying where communication is being lost or where the messages are being lost between case managers and service providers and young people. It's finding these bleak areas first. But then it's also working with young people. Like we've always said, it's working with the community. There are youth organizations dotted all over Asia Pacific. We should be using young people to help us with the messages. Communicate with young people, see them as agents of change, see them as experts in their own field, and ask them what it is that we need to do differently so that we don't have miscommunication when a young person is receiving treatment or a young person is looking to get information. So all the messaging is aligned. But I think the first things first is about identifying where communication is being lost, what needs improvement, and then actually working actively with young people so that everyone can have clear messaging on U=U.
That's great. So I'll put in a plug for youth lead here as well. So if you can't find any youth organizations, please contact Eddy.
Yes, please contact me.
Martin, any tips for other PLHIV to raise Uecosu conversation with the providers? What has been your experience?
Unfortunately, I think patients are sometimes educating their providers too. Because U=U is it's not new per se, but it's something that traditionally we have been, we look at medication as something to not necessarily to allow you to be free, but allow you to maintain your life or to keep your life. U=U changes everything. It changes every single thing we knew about living with HIV. With U=U, if the patient and the doctor, in fact, that's what I'm recommending, if patients and doctors really understand and work together to make it work, right? Because it's not so clear cut, it could change lives forever. And that's what needs to happen. So it is a partnership.
Great.
Patient.
Thank you, Martin. We have a special question from Dr. Nitya, and I'll post this to Pete. Is it necessary to use condoms even if a person with HIV is declared with undetectable HIV status? Is this thinking along with the line that the virus continues to exist within the system, or is it only undetectable and not totally eradicated?
I think condom use is so important for protect us to STI and unwanted pregnancy. But in terms of HIV, it's up to your concern to living with HIV. That if you need to protect only HIV and you are undetectable viral load and you have a partner like a wife, your husband, like a monogamy, right? So if you serious and you concerned about the HIV, use or don't use condom is up to your decision. But because you have one partner, right? Maybe you don't concern about the STI from outside partner, from other partner. But if you want to don't use the condom, it's up to you, your decision. But if you have a multiple partner, a casual partner, same partner, multiple partner, you have to use the condom for protect the STI and unwanted pregnancy. In terms of MSM, men who have sex with men like me, maybe I don't concern about pregnancy, right? I have to concern about STI. So, but if if I and my partner, both of us clear about my STI, over regularly get tests about the STI every 3 months. So if we are clear, both of us, and I use Uecosu and another one take PrEP, I will maybe. It's up to conversation and up to consent to talk together.
So making sure you have multiple messages for the people that might can then choose and then be empowered to make those decisions. Yeah. We have 5 more minutes, but we still have lots of questions to go through. We have one from Jeremy Tan that's going to Raine. Transgender representation in advocating for Uecosu has been limited and seldom seen in local level, which you already mentioned. Is APCOM having any plan in engaging with other country partners to bring transgender people in advocating for Uecosu in the community?
Thanks, Jeremy, for that wonderful question. Very beauty pageant. So APTN, we know we have started as well as the network engaging in HIV-related programs, but we have now moved for several years to bringing HIV into the broader context of sexual reproductive health, as well as into access to universal healthcare and to depathologize identities for us to be able to access free healthcare. So in this context, there are other technical partners that are experts in the clinical aspects of Uecosu. For example, the Institute of HIV Research and Innovation, IHRI, with their Tangerine Clinic. So we work closely with technical partners to actually introduce and have a combination of accessing both healthcare providers and community peer providers to work together in having a clear messaging to ensure there is a clinical aspect and a community rights-based aspect. So I think it's not only the role of APTN, but also other technical partners that are already working on Uecosu to work with country partners. And we believe that country partners, it should come from them if they need and they feel that this is important, and we can always have provide support as needed to them.
Thank you, Raine. Eddy, we have a question from Jesus Ramirez. Wow, what a name. Will this Uecosu not be misinterpreted as an act of condoning unsafe sex practices, since in the minds of one whose HIV is undetectable, they can no longer transmit the virus?
I think no. But I think it's just because if you think about what Uecosu means for people living with HIV, it goes even further than that. It's about bringing up their confidence and self-esteem. It's empowering. So I do think it's no. I mean, if you think about, there are 38 million people who are living with HIV. And if every single person knew about Uecosu, we wouldn't be having this conversation right now. We'll be talking about HIV in a different landscape, different discussions. So if you think about how campaigns are about debunking myths and false stereotypes, we're still living in an age where we're talking about, HIV as being a death sentence, and we're still doing that. We're still having campaigns where we're trying to tell people, no, this is not the case anymore. So I think with that particular question, I'll say no, because I think Uecosu goes even further for what it means to a person who's living with HIV that I possibly couldn't understand.
Thank you, Eddy. We have a question from Brent Allen, and I'll pass this to Raine. We know women and those who are gender diverse have poor health outcomes. How can we support healthcare workers to be better supporting their intention to seek the Uecosu message?
I wasn't just sure if the person was pertaining to trans women and gender diverse, but in any case, if I would respond from the perspective of trans and gender diverse communities on how to support healthcare workers, is basically understanding other contexts that trans and gender diverse might have issues or questions. As mentioned in my presentation, drug interaction between hormone replacement therapy or gender-affirming hormone therapy and the use of ART, as well as the use of PrEP and ART. And there has been studies that has been done already in Thailand to actually show that there are certain drug interactions. And I think healthcare providers need to know this messaging and include this in this discussion with trans people and gender diverse people.
Thank you. And then the last question goes to both Martin and Pete, actually. This is from Greg Gray. Pete and Martin are such amazing role models for the PLWHIV community. What drives you in this work? And what advice do you have on how to work in your community and how to get them on board with Uecosu? So maybe I'll give that to Pete first.
Yeah, yes.
Sure, why not? Sure, why not?
Yep, so what drives you, Pete, in your work?
I because I lost three things in my life. Because I lost before one thing. I lost my business because I have to exit my business because I found out my HIV status. So in that time, I thought that I have to die. So in that time, I get a lot successful my business. I get earn my 1 million baht a month in that time. So when I found out my HIV status, I exit already. I decided to exit. I abandoned already because I looking forward only 1 year, more 1 year in my life that I would like to die with peaceful mind. I don't want to do business anymore. In that time, I abandoned. And I lost the second thing is I lost my boyfriend. My boyfriend who is he is negative partner, and I engaged with him. I would like to stay long relationship with him, but in that time I don't understand that if I undetectable and alone, I cannot transmit the HIV to him. In that time I don't understand, and that make me self stigma. That make me depressed. That make me devalue myself. That make me want to kill myself every single time in that time. So before I love him so much. That make me before I don't want to pass the HIV to him. I love him so much. So I decided to block him up because of I understand use equal you. That make me so depressed more in that time. That make me broken heart. My life heart broken anymore, and makes me deep down into dark side to become a drug user, to become a sex worker, to become every dark side in my life. That's because of I don't understand use equal you. That's my passion. That's drive me is because I don't want to people living with HIV who don't understand or who don't know you equal you lost anywhere you think in your life anymore. So if I looking back that if I understand and I know you equal you at the first day I found out my HIV that I may not lost or may lost something in my life anymore. Maybe I am
you're so brave, Pete. So
HIV positive
for sharing.
status. Maybe I become a businessman, successful, HIV positive, and advocate in the world.
You are.
Maybe. Yes, thank you. You are now. And Martin, what for you? What drives you? Quickly, we are running out of time, unfortunately.
With AIDS, it's over. The only reason why AIDS is here is because we can't get over it. So let's get over it. And I think that drives me because I can't understand the fact that the stories that we're hearing. There's no point.
Thank you.
Really.
Yes. Well, that's a good way to end this session. I know there's a lot more questions. I'm so sorry we're not able to kind of get through everything, but I want to say thank you to our wonderful panelists, Martin, Pete, Eddy, and Raine. So a round of applause, please, everyone. Now it's time for you to grab some tea, coffee, stretch your legs, and we'll be back in about 10 minutes. So at 4:15 p.m. Bangkok time with the part 2 of the provider and policymaker perspectives. And if you still want to know about Uecosu work, APCOM is doing a webinar on Friday at 10 a.m. So do tune in if you want to understand more about that as well. Thank you so much for tuning in and have a good break.
Thank you. Bye.